So, in this short video, we're going to explore what sports therapists need to know when working with older athletes in musculoskeletal rehabilitation. We're going to draw key insights from Gill et al.'s 2003 PREHAB program paper, which is one of the first structured home-based prehab studies for frail community living older people. Now, the elderly population faces a high risk of physical decline, often leading to loss of independence and increased time in hospital. Understanding how to prevent or slow this decline is really important for us as sports therapists. Now, prehab was not a traditional rehabilitation program after injury. It was prehabilitation, which is a proactive prevention of functional decline in the home. Now, therapists assess physical impairments and prescribe tailored balance and resistance training. This research was a 6-month home-based physical therapy program, and it focused on frail adults aged 75 and upwards. It combined assessments and individual interventions. It used balance, strength, and conditioning exercises with TheraBands. And the therapist guided the participants through 15 home visits. Now, this program addressed common deficits, looking at balance, mobility, and deconditioning with safe, progressive exercises that could be performed daily at home. Therapists also considered environmental hazards and patients' education to reinforce independence. Now, the interventions within the research included balance training, upper and lower limb conditioning using TheraBands, task-related retraining. So, for example, transfers, stairs, car entry, carrying, and environmental assessment and modification. So, looking at rugs and lighting, and education for endurance and safety. Now, when working with elderly clients, our goal is functional capacity, not athletic performance. So small gains in strength or balance can actually give huge improvements in daily life. So we must adapt programs for safety, cognition, and environment. So using things like progressive overload, we must be conservative. So we start low and we progress slowly. Looking at balance and mobility training, and this is really important to reduce fall risk. Home-based exercises can be as effective as clinic-based if adherence is supported. Looking at cognitive status, fatigue, and other issues your patient may have, because these will all influence the progression of this program. And looking at environmental barriers, which often limit outcomes more than physical impairment. So what do the results from the study actually tell us? There was a 45% reduction in activity of daily living disability at 7 months, and there was fewer nursing home days in the prehab group. So this kind of really shows that even modest training leads to big improvements. The program was safe, showing that with the right structure, frail older adults can successfully engage in strength and balance training. Thinking about practical applications for sports therapists, you need to always tailor programs to ability and motivation. Education and empowerment are as vital as the exercise prescription itself. So always conduct full functional assessments looking at mobility, transfer, balances, and any kind of activity or daily living issues. Use TheraBands, chair-based exercises, and supported standing exercises. Really prioritize safety and confidence building. Reinforce adherence and self-management, so daily logs, family or carer support, and encourage environmental modifications to reduce hazards. What is the key takeaway message from this paper that we can put into our clinical practice? Now, rehabilitation in the elderly isn't about restoring athletic performance. It's all about restoring independence. Now, with patients being creative and structural support, sports therapists can make life-changing impacts on this growing population. Now, from the prehab paper, it showed that targeted home-based rehab is safe and effective for frail older adults. As sports therapists, we need to focus on early intervention before severe decline. We need to use functional task-related training, and we need to give patient education on environmental issues and adherence.